What are the chances of having twins in IVF? There used to be a time when twin pregnancies were extremely common in IVF treatment. But it's not the IVF treatment which results in twin pregnancies. It's bad doctors who transfer too many embryos at a time, which ends up with either a twin or a triplet pregnancy. And unfortunately, this is extremely short sighted. Doctors do it because they want to just put as many embryos as possible back into the uterus, especially if they're good quality embryos, because they know that the more the embryos, the better the chance of the patient getting pregnant. And every doctor wants their patient to get pregnant. The reason this is short sighted is because if this patient ends up with twins, the risk of having complications during that pregnancy increases multifold. The risk of a miscarriage increase, the risk of preterm labor increase, the risk of low birth weight increases, the risk of these babies ending up in an NICU increases, and it just creates unnecessary problems and complications. But you know what? The IVF doctor doesn't care. The IVF doctor says, hey, I did a good job. I got you pregnant. In fact, I gave you twins. So why are you complaining? And this is why it's so important that you understand that you can only get twin pregnancy in IVF if you put back more than one embryo. And this is why good clinics all over the world will transfer only a single embryo, what's called a single embryo transfer, so that these patients cannot have twin pregnancies. This is much safer for the mother and much safer for the baby. So we tell patients have lots of babies, but only one at a time, because your uterus was designed only to carry one baby at a time.